I'm Alexandra Kreis, and you're listening to Outer Travel in a Journey. In my own search for self-understanding, I have met people from all walks of life. I bring to you a taste of these encounters.
Welcome to Outer Travel in a Journey. On my show today, I'm welcoming my dear friend, colleague, and student Anna Rakovac. Hi, Anna.
Hi.
Did I manage the name okay? Yes.
Germans are the only one who could say it properly. As if
Yeah,
it was with TZ.
PZ at the end because Anna was born in Zagreb and currently
Well, in Istria, but it doesn't matter.
in around. Yes, okay. Oh, you were born in Italy, yes?
No, Istria, which is close to Italy.
Istria, yeah, of course, that's close to. Ah, okay. But you studied in Zagreb. So
Yeah.
as a chemical pathologist, um, you were you were encountering the war between Serbia and Croatia, as we call it now. You were part of that, and you worked in a pre-hospital emergency for 4 years, and you have now specialized on internal medicine. You worked in acute medicine and endocrinology. You're currently specializing. It's not currently chemical
So it's a bit,
pathology.
yeah. Like I have done many paths within medicine. Medicine is like a broad church. So when I studied, I had my visions of working in intensive care and kind of doing that kind of stuff. And then I worked in this pre-hospital emergency thing. It was in Croatia at the time, I mean, still now, the doctors are the ones who are on the ambulances, not just paramedics. So for 4 years, I was that. It was me
Yeah.
and a nurse and a driver, and we were either working in our base or we were going out to accidents. Then I specialized in internal medicine in Croatia. And then I used to be married to an Irishman, so I followed him to Ireland. And then I worked in internal medicine in Ireland and did research in endocrinology and diabetes. And then kind of married all of this together and did specialized in chemical pathology, which is something that many doctors don't know what it is. So it's a specialty of medicine that basically what I do now is I run a biochemistry lab and I oversee near patient testing. So all the little devices that you see near the beds that have to do with testing of stuff or pricks, capillary pricks or something like that. But I also see patients. I do metabolic medicine clinics, which are focused. I have a diabetes clinic and I have a lipid clinic, and I used to run a thyroid clinic, but I'm phasing that one out at the moment because we have somebody who's better than me at that doing it.
So what is your eager interest in those fields? Because that seems like a zigzag course to my ears. You know, you went there, then you went there, and how does it all come together for you? What was it that spiked it?
So a lot of it was circumstance.
Mm.
So if I had stayed in Croatia, I would probably be an intensivist in a medical intensive care unit. But because the life threw me around as it did, um, I what I thought I wanted when I came to Ireland was that I wanted to be an internal medicine specialist and subspecialize in endocrinology, and that is still a huge love of mine. But at the time, that wasn't too easy. No, not that it wasn't too easy. It was very difficult.
Mm-hmm.
So I heard about this program about this chemical pathology thing that I had never heard of before, and I went to read in the curriculum what their ideal candidate was, and kind of knows medicine, knows diabetes, knows endocrinology, did research around the ideal candidate. So then I tried it out and liked it, and that's how I stayed there.
So a pathologist, as I understand it, is somebody who detects the root of the cause, and then that's kind of you're like a detective in
Yeah.
medicine, yeah.
So the detection bit I do is on tests in blood and biochemical tests in blood. And this is what really appealed to me when I kind of went in to try the specialty, is because it's holistic. You don't know everything
Oh,
about just diabetes or just endocrinology or just gastroenterology. Like you need to know how to diagnose everything. So suddenly I had to go back to reading things about ways to diagnose diseases that I hadn't dealt with in a long time. So I think for me in medicine, it was always about looking at a whole picture. And the reason I liked endocrinology is because endocrinology is all about balance, and
mm-hmm.
it's all about figuring out what is inappropriately normal. So,
Hmm. And so, as we are still in the pandemic, this is nothing, when I started this podcast, I thought like I have to put out all these pandemic shows, but we are still here. So we can talk about it. How is that affecting your job currently as you're testing blood? Is that, mm,
so it affected it a lot in the beginning. I spent the
mm,
whole of month of March. I don't think I have studied that much for any exam in my entire life. Like I spent about 19 hours a day, and I'm actually not exaggerating.
mm,
Uh, Working, and if not working, reading. See, because we were witnessing something unique, and
yeah,
scientifically, if you can look at it only with the mind, it was exciting, because suddenly all those things that we learned in history of medicine, and then Paracelsus described this, and Hippocrates described this for the first time, and Galen described this other thing, and Avicenna, and suddenly we had a totally new disease happening in front of our eyes that
mm,
nobody has ever seen.
mm,
And it was a very scary place, because we, as doctors, we are used to operating with the knowledge of the past X thousand years. Well, particularly the last three, 400. But you are used to things being known. And what we were busy with before the pandemic is looking into the nitty gritty of the physiology, pathophysiology. Does the how do the cells interact in between themselves? And suddenly we had this massive, huge picture thing that nobody knew how it was going to behave. So, uh,
yeah.
like we didn't know, like in the beginning of March, when we had the first patient in
2020,
Ireland.
just to clarify that,
So
just
yeah,
so.
like it's all one mess. It's 2021 now. In the beginning of March 2020, so the first patient in Ireland um, was diagnosed on 29th of February, like leap year. Eh?
Mm-hmm.
Talk about the leap one, and but we didn't know how these people are going to behave. Like in the beginning
Mm,
of March, we didn't know that they will be prone to clots,
mm,
and then by April we knew that they are going to be prone to clots. So
mm,
by end of April, say. But
mm,
like there were so many things happening and it was extremely stressful. I I'm not the person that's prone to anxiety at all. And I was waking up with those bangs of, oh my God, what do I have to learn? What have I not read? What do I need to do? How do I get my lab ready? What are the tests that were proven in Wuhan
mm,
to predict outcomes? Do we have all of them happening at this kind of in routine terms? There were most we did, some we didn't. Off we went to find them, set them up on our machines, verify that they're performing correctly, try to see what would be the best predictors. It was mental. And then in all that turmoil, um, I ended up contracting it at the 25th of March. So then I got an interview of how
You got an
how do we
in-house review to
total,
assess.
from
Yes, and I remember that you
a proper
described it for
deduction
the.
from the big.
Yes, exactly. So you
Yes,
and I
sorry,
remember you describing it on
there's a
Facebook
lag.
for people to understand what the experience was in your case. And I understand there is always different experiences going on. Okay, let's go back. You just described that you got an inside view to COVID. You survived it, and I remember you describing it in detail for people to explain what the experience is, like the way you kind of had to deal with it. And what marked my attention at the time, because you were not only a doctor, but you were somebody, as you already proved through your diverse studies, that you are interested in the bigger picture of things. So you kind of ended up learning Ayurveda through me, with me in applicable form. And so, what I remember you saying is that the breathing techniques you remember also from the yoga classes you took with me were mainly helpful. And so, this is a funny thing how one science kind of supports the other. And this is how I see our relationship as well, Anna. Like a lot of people don't see Ayurveda as a science, even though it says Veda as in science, and it's not being acknowledged broadly as a science, but there is some connection there. It doesn't mean that we have to fight against each other. But yeah, you were about to say something there. Let me hear what you have to
Yeah,
say on
and you're right. The Ujjayi breathing I learned from you was
that.
really instrumental at the peak of my disease when I really felt really unwell. See, the clots I was talking about, I think now in hindsight that that is what stopped me from breathing then, that I had two clotting, microclot episodes. But like at the time when I had them, we didn't know that this could happen in COVID. So then I thought I was panicking because I was coughing and I was short of breath and all that. And at the time we started knowing, like in anesthesiology, there's this technique, it's called proning. It means putting people on their bellies
Mm-hmm.
for them to breathe, because you know from yoga and I know from anatomy that
Mm.
most of the lung is in the back of the lung, because diaphragm is like a dome and it's shallower on the front and deeper on the back. So on the
Mm.
back the lung dips. So if you breathe, if you're on your belly, you use more lung. And
Yeah.
that is the same principle in Ujjayi breathing, because in
Mm.
Ujjayi breathing, and I have taught it to anybody that would listen at a
Yeah.
time, you
Yeah.
basically are learning not to breathe with your belly but with your diaphragm. So
Mm.
yeah,
Yeah.
there are a lot
Yeah.
of things like what I found with Ayurveda is it's an observational medicine, and that is how my medicine started. Like it's not two medicines, it's the same medicine, it's the same body, it's the same, like
Yes.
the observations you can make are the same.
Yes.
It is how you get into interpreting what is causing them that differs. But
Because
if you
it's a
can,
different language,
like,
obviously, like between yoga. I mean, as you said, you were talking from an anatomy perspective, which is how we see it from the yogic point, is done on dead bodies before. Anything we learned for a good long time about medicine was done through dissecting people and kind of cutting them open and seeing what the brains look like, the lungs and the organs, yeah, but not in action for a very long time. Yeah.
but before we did that, we were looking. So before we started getting permission from the church in the West or the
Yeah.
state, which
Uh-huh.
only came in the 18th century, we were looking at how the body moved alive, because a dead body was no use to us
Yeah.
then. And it was
Yeah.
only with Galileo, like with Renaissance, that you started looking at the inside. And both are important.
Absolutely my point. And recently I feel like we are kind of supporting each other in forms of understanding. I mean, you said what happened to you after you done a lot of studies around the daily rhythms, the chronobiology stuff that I'm teaching, more or less, like what is the rhythm of nature, what is the rhythm of your body. They are in sync if we let them be. So you notice how your conversations with the patients you still see has shifted for you. Can you tell us a little bit about
Yeah,
that?
it has. Yeah. So I have been interested in chronobiology and the molecular side of it before I started doing the course with you. And then it amazed me how a lot of the things that I was reading about in scientific journals that had to do, so each cell has its own clock, and those clocks are not all the same. Different cells have activation of their own clocks at different time. And then, I mean, like you know, but the listeners don't know, the way I fell into your teaching was I just needed to something to keep me on the kind of straight and narrow, because I was trying to get into my own, I don't know, eat less, move more, kind of
Yeah.
be healthier. And
Yeah.
because we had known each other from before, and I had huge respect for you, because a lot of people in your world disregard science and
Yeah.
disregard my world and behave
Mm-hmm.
as if we were the enemy. And you weren't that. So that is why I basically had enough confidence in you and enough trust to go and, oh, I won't be listening to a lot of mambo jumbo if I go listening to Alex. So no, this is how it started. Like that's exactly how it
Yes.
was. So yes, it did. What you were teaching me were observational lifestyle interventions that were 5,000 years old, that totally aligned with what I am I was teaching up to that point my patients in the, for example, diabetes clinic.
Yeah.
Because diabetes, like we were already saying, eat less concentrated foods, eat more plants. Well, I wasn't putting that much of an emphasis on plants then, but I do now,
Mm-hmm.
because it's all about concepts, how you conceptualize things in your life. So it was eat less, move more, but it's all about, on one end it's compassion, and on other end is how do you transfer the message effectively. So I knew before I did your course that you can at best hope for a person to remember three things you tell them. That's if you're lucky in any encounter.
Yes.
And you have to pick one. So doing your course and the whole thing of eat your dinner early, leave space for you to digest. Do not. So what I would have said before was do not snack at night, because that is when
Mm-hmm.
you are going to accumulate, because of the insulin resistance and the liver clocks and all. And and now it's kind of eat your dinner early, go to bed early, get up early, move. And it is simple. Like I don't,
Yeah.
so in my practice I don't go further than that. I don't go dealing with anything else that I have learned from you, but picking one thing and trying to see, I guess it was, sorry, I'm trying to say too many things at the same time as
I know.
always.
I feel the
But
same all the time, but I want to put it out all there. But yeah, so you're saying the way you communicate with your clients is in some ways becoming more clear because you learned more practical application of your knowledge. Is that, or is that fetched too far?
that it's kind of a different slant. What I had
Yeah.
learned from you was, so first it's the concept of what we were learning of. So these were, again, for those that haven't done Alex's course, the first four lessons: eat
Yes.
early dinner, go to bed early, get up early, and move.
Yeah.
And this was enough. And kind of the way that I learned about habit formation, because I think that is what we do not get taught in medical school. And there is this over emphasis on knowledge and not enough emphasis on how to bring the knowledge about the way that somebody's body is working into practice. But so if knowledge was everything, I would be a skinny triathlon competitor, because like I know everything there is to know. But
Yes.
the way that what I learned in your course was how to set a small achievable goal, kind of the what is called SMART goals, small manageable I can't, I can never remember acronyms. But
Kaizen, small
the,
incremental steps, and the course is called Creating Space
exactly.
for those who start to wonder to listen. Yeah,
Oh, yeah,
okay, go
sorry.
ahead.
Yes, I should have said that to begin with. So how to take a small goal, how to make it happen, how to build on that small habit change. Because what I think paralyzes, certainly paralyzed me and paralyzes a lot of my patients. So suddenly
Yeah.
they have been living all their life in the way that the West lives,
Yes.
and just, I mean, they lived their life the way they knew how to live them, and suddenly they're given this diagnosis of this invisible disease that is diabetes, and they go, or high cholesterol, which is inherited. In the bit that I do in my clinic is the inherited one, and suddenly you are dealt with this. You feel no different, nothing hurts,
Mhm.
and you go Google and you find out your legs can be amputated, you can go on dialysis, your kidneys can fail, and then it depends on what kind of
Scary.
personality you are. Are you going to get totally scared and obsessed, or are you going to go la 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 la,
No,
not
yeah, give me my
listening, not
drugs. I'm
happening,
gonna do this with the drugs. Yeah.
out?
Hmm. Hmm.
And drugs are great.
Yes.
We need them.
Yes.
We absolutely need medicine. Well, I mean, not as in medicines, like not,
Mhm.
and this is where, yeah, like least anybody knows, there is a doctor advocating drug use on podcast. Uh,
Yes, I heard that, but we know he didn't mean it like that. Yeah, okay.
yeah, yeah, no, but so the easy way is to, for just me to give the medicines I know which one does what, in what
Mm,
sequence to go about them,
yeah.
and just do that. First of all, people don't take medicines unless they know why they're doing it. And that is well known. Compliance. Most people don't take their medicines as instructed. And
Mm,
there is a whole behavioral science discipline looking at compliance with medicine taking. So I was explaining what each thing did even before,
mm,
but with the small incremental habit changes, and with letting them know where does the medicine I give them come in. So if there was this one conversation, the man came in and his diabetes control went all off, and he was really depressed when he got in, and he was going to, I was thinking of not coming in because I know I've been checking my sugars, they're going through stratospheric, you were going to give out to me. And I don't think I would have given out to him even before I did the course. But what I learned on my own skin doing the course was praise the positive. I mean, we do that anyhow. I mean, but it was because I learned it on my own skin that it made an impact. So I was going, no, congratulations. And he goes, what? Well,
yeah.
congratulations for coming in.
Yes.
If you stayed at home, we wouldn't be having this conversation. So fabulous. You have done the most important thing today. His whole body changed
Mm,
just with that shift in perspective. And then we went through his plan and what he could do, and when was he going to bed, and when could he incorporate exercise into his life. Now, I am lucky. The way that my clinics work at the moment, I have some control over my time.
mm,
So I could give this man 20 minutes.
mm.
A GP, an average GP in Ireland or in Germany or in Croatia, has 10 minutes if they're lucky.
I have a
So I
GP. He
think a
sits
lot
there
of,
and listens and listens and listens, to be honest, and as it is,
well, then that's brilliant.
yeah. And you find
In
what I'm trying
Ireland,
to
the
say
way they,
here, Anna. What I'm trying to say here, Anna, is we don't have to put up with people that kind of pull us through. But no matter how you're inclined to live your life by the advice of a doctor or by the advice of natural medicine combined with a doctor, you can find these people. I mean, look at why you're on the show and why I have you on the show. Just as an example of noticing that the small things like communication is super important. And I'm not saying something revelational here, but what I also wanted to stress, where we both find that we are struggling to make people aware of is that the small things matter, and we
Yeah.
that the small things matter that look like, oh, I'm just doing that. Oh, I just sleep in. Oh, I just missed my yoga class. I missed my sport. I missed, oh, I'm just going to be a little bit, I don't know, whatever it is, or I'm just going to miss my doctor's appointment. But it could be that appointment that brings conversation into your life and shifts your perspective. Yeah, that's what I wanted to highlight here.
No,
Sorry
I
for
totally
interrupting.
agree.
Hmm.
No, sorry, like if you don't interrupt me, I'll talk until the cows come
She
home.
can talk until the dawn. I know her so well. That's why I kind of jumped in, and it's beautiful how much you have to say. And another thing that was the very reason why I brought you on the show, just for you, dear listener, to know, is that Anna, just as she shifted her perspective, as I see her shifting her perspective and really taking these parts of advice as part of her medicine, I saw her also highlighting the importance of rest, which we don't know anymore in these times of fast tracking and instant gratification. Can you say a little bit about like resting? What's your on take on rest and healing and yeah.
So, my first huge lesson in the importance of rest and not forcing your body through was when I was in an intern. There was a young man who had a mild viral infection, like he had a bit of a cough and a bit of a fever and a bit something, like no big deal. And because he was a keen runner, he kept running through it. And then he was admitted with a heart that instead of this size was a balloon. Like, because like
So
your
for
heart
those who
should
are
be
listening to the audio,
sorry,
she's putting her
maximum
two
two
fists
fists.
together. Is that's the size of the heart, and then she let her hands go really wide
Maximum.
at maximum. Like that looked like chest size to me that you just indicated.
Yeah, so this guy's heart, and this is what's called dilated cardiomyopathy. So this guy's heart took up most of his chest, like
Yeah.
2/3 of his chest. That's how large it got. And I was shocked. Like, this was the first time I was seeing this. And the cardiologist was saying, yeah, he shouldn't have ran. He got myocarditis. If so, myocarditis is an inflammation of the heart. In this case, it was viral. And if this guy had slept through his mild viral upper respiratory tract illness, he would have recovered and nothing would have happened.
Yeah.
But, well, hopefully, not to say it could have gone
We
wrong
don't know,
anyhow,
but
but
yeah.
we don't know. But running certainly didn't help. And this was the way that my teacher was telling me he shouldn't have ran. He put extra strain on those inflamed heart cells, and now they just lost their elastic and went from, the fist size to the gallon size.
Mm-hmm.
And I was just shocked. And this was the moment when I made a decision that whenever I get sick again, I am not pushing through. But more and more was what I learned as life went on is in my life, I was pressurized so many times to come to work ill. And one great effect of the pandemic will be that all those work heroes will be shunned. Like, that is going to be one huge shift. And I think that as long as the current generation is alive, if somebody comes into a crowded room coughing and spluttering, they'll just get the dirtiest looks ever.
Absolutely. You can't cough on
And
the
I think that's
underground
great.
anymore. Yeah. That's the way
I
it
think
is.
that's great. But I think that this whole um this this one track thinking of productivity, efficiency being above everything
Mm,
disregards the cyclical way that humans are. We need rest. We
we need
need
rest.
to sleep. Like, there is an amazing correlation between obstructive sleep apnea and diabetes.
Mm.
So if you have obstructive sleep apnea, it usually has to do with you carrying more weight. But not everybody who carries weight is going to get it. So your kind of airway is strangled by your own flesh because your sleep is not uh, of good enough quality, and you wake up the following day, you're constantly hungry, and that is well known. Then
Mm.
because you're constantly hungry, you're going to put more weight on, and it's going to bring you towards diabetes if you have a genetic predisposition to it. So it's all interlinked. And the first thing we're going to do in those people is prescribe them pumps that are going to help them sleep so that they can have enough energy the following day, so that they can exercise, they can be less hungry, they can stop overeating, and they can start moving into the path into health. So like
Mm.
we need to rest. We And then my own COVID thing totally taught me, like ever since I was sick, like I'm scheduling sleep.
Mm.
I'm putting in
Yes.
8.5 hours,
Yes.
and that's it. Like it's
Yeah.
non-negotiable. And this is from a person that spent most of her life on six tops.
Yeah.
So
Thank you for pointing that out, and because I find that so important. And I, I raise my hand here in guilt as much as you, guilt and shame. We all go through these phases of life where we are challenged and where we find it exciting, the rush of half a bit of sleep and then having to drag yourself into work and, making it through it. It's almost like we are missing these rites of passages. That's what I kind of felt. That was a recent conversation I had with somebody. It's like in the olden days, or whenever that stopped in our cultural background, it hasn't stopped in all in all the cultures. There was a marking day when there was a marking date or a time into adulthood where the the boys would be challenged, where the girls would be challenged, and they had to go through a rite of passage, which was quite, adrenaline pumping thing. And once they ticked off that list, they felt more in gear to be just who they were, like adults that take responsible about their sleep, about their food, about raising, about, whatever it needed to be. They took place in society. Since we don't have these rituals anymore, these kind of student nights, and I don't know what it, and some people carry it forth into old age, they become the missed rite of passage in my in my kind of um, sense of understanding it. So sleep is important, and not that kind of sleep you do in the day, the napping here and there, but the what Anna said, the continuous sleep of good night's sleep. Oh yeah, and how and there is different way you can engage with that, and if you're ever interested to learn that practically, I welcome you to do my shorter course that's coming out next year in February 2021 on, getting into bed so that you can sleep and getting up so that you can start the day. Everything we touched upon with Anna just now as a keystone to avoiding diabetes, eventually avoiding like heart diseases, anything that comes along, it's so hidden in us, we can't see it. And still our intuitive mind knows it. So, Anna, before we part, thank you very much for giving so much light to this subject on a really scientific basis. What is your last word to our listeners? What do you want to say to people right now?
do I get seven last words?
You can
the
say seven last words, like what say what is it
Yeah,
you want to
no,
feel
no.
like
Yes,
your
I
gift
I
to
think
us?
that what we do need to really wake up to is the necessity of observing and respecting the interplay between our own rhythms and the rhythms of the planet, and keeping the health for as long as we can, when but without it being a pressure of a function of something. I think there's too much emphasis on health is in order to be pretty, in order to be productive, in order to, I don't know, whatever, achieve some other goal. I think it would be great if we taught all of this in school, because
Hmm.
how about just learning how to be healthy in order to be happy? I know that American
Yeah.
Constitution may be the most optimistic bit, they have the right to pursuit of happiness, but like, why not? So, and also, like, my medicine, I know a lot of people who listen to you would be more of the naturopathic kind. Like, my
Yeah.
medicine is not the enemy. We are here to
Mm.
help.
Yeah, and that's definitely what I feel. You might have felt yourself in a situation where you were happy. If I think back, I haven't encountered so much medicine, but more lately. But if I hadn't had the aspirin or the paracetamol for one occasion, which comes from research, which comes from that part of us, I would have kind of suffered more than I wanted to. So we all engage with it. Yeah, I do agree, and I don't think that people in my world or my listeners are solely naturopaths, but maybe with an emphasis on wanting to be seen on that level as well. And that's where I feel like we have to stop fighting each other. We have to just kind of know how to join hands, and stop pointing fingers. As you said, like you came to my course because you knew I would kind of make space for everybody to live, and that's what I see from both
Yeah.
sides. That's what we have to do. Yeah. Well, thank you. And for your time, Anna. And thank you, dear listeners, for joining us in this conversation. If you have questions for Anna, I'm sure we find a channel so that you can communicate with her. Or if you have interest in learning those habits, the steps of Kaizen, please look into the show notes. Everything is presented there for you.
If you enjoy listening to my podcast, please consider to become a patron at patreon.com/alexandrakreis and pledge your donation.